we have with us Rachel Kelly from the UK. She's a leading British mental health advocate, is a best-selling author. She's written 6 bestsellers. She is on leading charities on mental health in the UK. She's an ambassador for a few of them. And she's widely quoted in the media. She's regularly on BBC television. Thank you so much, Rachel, for joining us, and welcome to this session.
My pleasure. Thank you for having me.
Rachel, obviously this is an interesting time for the entire mental health community and for people who are going through some very tough times, the world over. And you have been also doing a lot of talking and a lot of workshops in some of the world's leading corporates. And what has been your experience? Do you find people are going from one extreme to a new one where they were earlier not talking about the importance of mental health to now it, being there on every fora and it's almost coming out of our ears?
Yes, I think my experience since lockdown has been that people actually have very mixed response to this period. Then it's not uniform at all. There are people who actually are finding this quite a positive period. This might sound counterintuitive, but for some people, it's been a chance to not have so much FOMO, fear of missing out. They've actually used it as a chance to go deeper and reset and think very profoundly about what matters to them. But you're absolutely right. There are others who are finding it a very difficult period and who are suffering, who are very anxious and even into full depression, because there obviously are huge problems with people being unwell in one's family and redundancies and unemployment. So I think it's quite a mixed picture, but I do think it's important to keep that balance, that people's experiences is varied. Your second point about what are we taking this too far? As you say, a huge focus on mental health. I think we in some ways it's good. So there is a valid argument that when we cover things up and are not open and authentic about what's happening to us, then that is an energy and it requires work to sort of pretend that we're all okay when we're not. So I am in general of the view that it is good to talk about our well-being and to be true to ourselves. And if we are having a problem, we do need to talk about it, because mainly, as I say, the energy of covering it up, but also not getting the help. But having said that, I am cautious that we need to keep this in proportion as well. A bit of anxiety is perfectly normal, and these are worrying times, as you said.
When we talk about anxiety, I work a lot with senior business leaders, corporate leaders, and sometimes I get a sense that they pride themselves in the fact that they can go for months or years without having to open up about, the stressors or, what they are going through. And then you've got this whole phase now where they are being exhorted to sort of talk about just about everything from the context of being a stressor. And what has been your sort of experience when you do some of your workshops and, some of the corporates that you work with?
Yeah, well, I think you make an interesting point. There is something gendered there that I think on the whole, traditionally, there's a macho culture, particularly around male CEOs or business leaders, that they find it hard to be vulnerable, or they traditionally have found it hard to be vulnerable. People say that the counterpoint in women business leaders and CEOs is that sometimes they find it hard to be angry. Sometimes people say depression is like anger turned in. And not women find that emotion hard to access. So on both fronts, there's a sort of maybe a backstory that both men and women have found it hard to be in touch with their feelings. As you say, the context now is very different, and we are all being encouraged to be more in touch. So in general, this is, I think, a good thing. I think the leader position is incredibly important. So, for example, when I'm working with law firms in the UK, what I notice that is unless the partners get on board and acknowledge that there is this topic and well-being exists, and really positively, there's things we can do to look after our mental health, the juniors are not going to get involved. So it really is essential how the leaders you know, that it's not so much, you know, what they say, it's actually what they do as well. So things like if they take time out when they need it, all these are very important, and it is very much focused on leadership in these companies. So look, it's a good thing, but I think there has to be a proportionality here. We don't want to go too far the other way.
Yeah. You know, in some ways, the UK and, you know, much of US as well has already been through this journey of, you know, over diagnostic, you know, this whole culture of diagnosing everything as a mental health issue, pathology, and you know, medicating it, right? And
Yeah, I think
uh,
you're absolutely right. I think there has been a bit of a backlash here in the UK. There's organisations like evidence-based psychiatry rather, and even very mainstream psychiatric institutions like the Royal College of Psychiatrists now is subtly adjusting its advice and acknowledging that, you know, no one would ever say that medication isn't important, especially when you're extremely unwell, suicidal. You know, no one is ever going to say, you know, medication doesn't play a role. But it's in this kind of gray area where, you know, from time to time you feel very anxious or very well to medicalize, because I think what's happened now in this kind of backlash period is there's a sense that we have more of an understanding of some of the issues, for example, of coming off the drugs. There's a very interesting new guidance from the National Institute of Clinical Excellence in the UK. The NICE guidance is now saying, you know, doctors need to tell patients when they start medication, you know what, you might find it hard to come off. The withdrawal symptoms are very real, and there's much more guidance about this process. And I think the consensus now is not to say no medication, but to say medication is for severe cases and it should be used in moderation and not for long periods. And one of the big problems we have with long-term taking of medication, we have very little data and evidence about what that really leads to, and research around that. So I think there is now more of a feeling of not just let's be cautious and only really use medication we have to, but also let's think about all the other ways we can help. And I think that's what's so positive and exciting. And if anything really good comes from this period, is we are now really focusing more on all the other strategies and ways to look after ourselves. And I know you and I both have an interest in nutritional psychiatry. So this is, you know, using what our diet for well-being. So some of these other ideas are kind of gaining traction, and that's a very exciting thing.
You know, when you speak of medication and the entire sort of patient and public backlash in the Western world now on psychiatric medication, what has been your personal experience, you know, dealing with individuals or even, you know, some of the charities that you're associated with? Have you seen personally that now people are genuinely tired and have sort of given up on years and years of being medicated?
Yeah, I mean, I think my experience, I have to be very careful because I am not a psychiatrist, so it's a difficult area in some ways. Where I feel very, very confident. So the groups that I work with, so I run good food mood workshops in the UK using some of the nutritional interventions. I also run psychological well-being workshops using exercises. I call them my singing in the rain workshops. And what I feel very, very confident is that even if you are taking medication, the NICE guidelines, so back to the National Institute of Clinical Excellence, their guidelines is that medication is much more powerful if you use all these other things as well. So you've got nothing to lose. What I feel is kind of now a consensus much more in my experience and in the UK more broadly, is that, you know, it's great if you do need medication, but don't just use it on its own. You know, use some of the psychological techniques, use some of the mindful techniques, the breathing techniques, the meditation techniques, use some of the nutritional interventions, use all the different things that we now know. You know, a very obvious one, people say, you know, if you could bottle it, you know, it would be the most powerful drug in the whole world. And, you know, that is just exercise. So I think now this is how I think I feel very, very sure that what I would have liked when my own serious depression and being hospitalized with depression and very much a medical route is I would have liked it if I'd had a sense of this other, you know, a broader range of strategies, and not just thinking it's medication or bust.
Right. What are some of the areas that you have been able to use successfully? You mentioned nutritional sort of medicine, if you will, and
Yeah. So
well-being.
this became a great enthusiasm of mine about 4 or 5 years ago. I saw my GP and I was still on medication. And as I left, she wrote on her prescription pad 3 happy foods. And I never thought there was a link between nutrition and mental health. And she wrote down oily fish, so tuna, mackerel, herring, you know, flax seeds, hemp seeds if you're vegetarian or vegan, oily fish, dark green leafy vegetables, and dark chocolate. I thought, well, that's pretty nice. You know, I like dark chocolate. And I said, tell me more. And she said, well, I can't, because in the UK, a GP, a general practitioner, only have 7 hours training in nutrition. So I teamed up with a nutritional therapist who had 2 degrees in nutrition and by all the science, really. And we did this book called The Happy Kitchen. And it's really how we can maximize our well-being through mental health. I share one thing here, which is the importance of these omega-3s. So you'll have heard of omega-3s. There's 3 kinds of healthy fats, 3s, 6s, and 9s. And in nutrition, we're always looking for balance. So people on a very typical high-fat, high-sugar Western diet, I'm not so sure if this is relevant in India, but for people on a more Western diet, they don't have the right balance. They don't have enough of these omega-3s. And the reason these omega-3s are so good and important for our mental health is they're anti-inflammatory. And this is a huge new area of research, which is linking depression with low-grade chronic ongoing, i.e. ongoing an inflammatory response. So we want our diet to be anti-inflammatory. And then there's all the research around gut health, improving our gut health. So that's the microbiome, the makeup of the bacteria. And we want more of the healthy bacteria. So that's why the doctor said dark green leafy vegetables, because that's the sort of probiotics. So that's the thing that the healthy bacteria, the prebiotics, that's what they, other way around. The dark green leafy vegetables are the probiotics. That's what the healthy bacteria feed on. So it's good for our gut. And there's a link between the gut and the brain. So we have a nice, calm digestive system, nice, calm brain. So there's some ideas there. And I think probably the other thing I would mention that I'm using a lot is just some of the breathing techniques. So I think for a lot of people at the moment, their anxiety is there in the future. You know, what will happen? Will I fall ill? What will happen to my business? Will I get sacked? Will I have to sack people? They're in the future. And also they're in the past. Like, you know, I've got myself into this stressful situation. I wasn't prepared. You know, how were any of us prepared for what is happening? But if you think about breathing for a moment, you can't breathe in the past or the future. You can only breathe now. And it's a great way to trigger the relaxation system. So the 2 rules, it's always in through your nose. The way I remember that is there's little hairs on your nose, which is the right temperature, and they catch some of the bugs, which is a good thing right now. And it's always out through your mouth. And then to get that relaxation response, the out breath is longer than the in breath. So it's one thing that I use a lot with the groups is to just sort of use some of these breathing exercises to just come back and be present, centered, and in the moment, because that's really what is the beginning of wisdom right now, is to focus on now and make the best of now.
You know, what you've said is just so important. And to come to think of it, you know, a lot of Indian ancient philosophy around the practice of meditation and deep breathing,
Yes.
called it pranayama, which has been practiced for thousands of years, is now being re-looked at in a scientific manner, not just for its benefit on mental health, but even in terms of overall well-being, and, you know, digestion and, you know, cardiovascular diseases, how it can help. And
Absolutely. I mean, the Eastern tradition is ahead of the curve. I mean, as you say, that some of these traditions and also it isn't, as you say, there is a physiological effect to sort of, you know, lowering heart rate and, you know, just bringing our kind of stress response down. But what I particularly find very helpful is a spiritual dimension as well. You know, it isn't just physical. So one of the practices that we use a lot is just when you're in that more calm frame of mind, just to bring to mind other people and what they may be going through, and to put your own experiences into perspective. And I think that spiritual philosophical dimension and allowing that space is also very important. So you know, hats off to the Asian, Indian, Eastern approach. It's something we have a lot to learn from in the UK, and I'm so pleased that we are beginning to realize that.
We all live in interesting times, Rachel, where I think the best of both worlds, the East and the West, have to come together in terms of old philosophies and new technologies, new research, to try and give a very holistic package to an individual.
I think this is so true. And I think it's one of the ways that in the West particularly, and maybe back to, you know, being careful of the over the pathologizing route, is this split between mind and body. And, you know, it came from the French scientist René Descartes. And, you know, he gave us this word Cartesian, the Cartesian model. And the Cartesian model splits mind and body. And we still have this as an approach to mental health. You know, we have physical health and we have mental health. Well, this is nonsense. You know, the two are completely indissolubly interconnected. Our physical and our mental are, you know, one and the same. And this is a kind of, again, maybe something which we have to learn more of an Eastern approach, is that they're not separate. And maybe we're coming more to an Eastern approach on that.
Well, this is an interesting discussion, Rachel, and we could just go on and on, because you've got a ton of knowledge and experience out here, but we've run out of time. But thank you so much for joining us, and some very you know, good insights on how we all can use what we have at our disposal in a better way. Thank you so much.
My pleasure. Thank you.